Good morning, my name's Dawn Fuller. I'm a nurse practitioner student at Auburn University. Today I will be demonstrating a head-to-toe assessment. My patient who's volunteered is Gussie, a very good friend of mine. So we're going to start our head-to-toe assessment. First and foremost, Gussie came in. We have done her visual acuity. We have done her vital signs, her BMI. Everything is within normal limits. Her visual acuity, cranial nerve 2, is 20/20. Her gait is normal. And she is alert and oriented ×3. So we're going to start our assessment now. So I'm going to watch Gussie. I'm going to just take a look at her hair, her face, her neck, her general overall appearance. She's healthy, well nourished. Her hair is evenly distributed over her head. We're going to palpate her head for any lumps, bumps, and noting any scars, lesions, or anything. So. Any pain? Okay. I'm also going to palpate her sinuses. Any pain in your sinuses? Okay. I'm going to take a look around. Her hair is evenly distributed, very soft. She is a good specimen for us to work on. So we're going to look at Gussie's mouth. I'm going to do your gag reflex and you're not going to like me, but I'm going to have you open. Lift your tongue up, down, to the side and side. Her oral mucosa is all intact, no lesions, no bumps. Her dentation is good. Her tonsils are symmetrical bilaterally. All right, stick your tongue out for me. Say ah. Gag reflex is intact. Dentation, I said, is good. Now what we're going to do is we're going to examine her ears. We're going to examine the exterior portion of her ears, her interior portion of her ears. We're going to palpate her ears to make sure that there's no pain in the ear. And we're going to visualize the internal structures of the ear. Oh, let me get them. That's okay, I got another. Get it to stay on there.
Calm down.
There it goes. All right. And visualize the internal structures. The tympanic membrane is intact. All the internal structures of the ear are intact. And they are intact bilaterally. Alright. So we're gonna move on. I'm gonna have you close one side of your nose and sniff, and the other side. I want you to close your eyes for me. I want you to tell me what you smell.
Peroxide or something.
It's alcohol. Okay.
Oh, well.
Each nostril is patent. We're just going to take a look to make sure.
Don't jump outside.
Both nostrils are clear, patent. There's no deviation of the septum. Okay. Now we're going to look at Gussie's eyes. Oh, use my pen light. Okay. So I just want you to look straight ahead at me. Both pupils are equal and reactive. All right, what I would like for you to do, let me cut this off. So what I would like for you to do is I would like for you to cover one eye. And now cover the other eye. Okay. The cover test is good. Her eyes are equal and reactive bilaterally. Now what I would like for you to do is I would like for you to look at, trying to give you good. What I'd like for you to do is I'd like for you to look directly at me. And what I want you to do is I want you to tell me when you see my fingers in your visual field, okay? So I want you to close your right eye. No, leave them open. All right. Tell me when you see my fingers.
Oh, right there. I can see them all the time before you move them. Yep. Yep. And yes.
Now we're going to inspect her eye.
Thought you already did.
No, the interior structures. All right. Red reflex is intact.
See my hand there?
I don't want to pull them out.
No. You can't. Being big.
The red reflex is intact bilaterally. Retina and all the structures in the eye are within normal limits. There are no hemorrhages, any lesions that were noted in either eye. All right. Now what we're going to do is we're going to test for lateralization, which is actually a hearing test. So what I'm going to do is I'm going to strike the tuning fork, I'm going to place it on the top of your head, and I need for you to tell me if you hear it on both sides, okay?
Just on my right. My left.
Just on your left? Do you have hearing loss on your right? Okay. Now what I'm going to do is I'm going to do what we call bone versus air conduction. I'll hit the tuning fork, I'll place it on the bone behind your ear. Tell me when you quit, when you can't hear it any longer, and then I will hold it next to your ear and tell me when you can't hear it any longer.
I don't hear it at all.
Okay?
Oh, no, then. I can't.
Okay.
Okay. Okay. Well, I hear it. I don't know why I didn't hear it a while ago. I'll hear it. Okay. 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 Damn, that was good, wasn't it?
Yeah, that was good.
I'm talking about the other one.
All right.
How do you hear it like that on the other side? I don't know.
Alright, so we have cranial nerve 1 is intact, cranial nerve 5 is cranial nerve 2 is intact with visual acuity. Now, what I would like for you to do, I'd like for you to close your eyes, and I would like for you to tell me when you feel me touching you.
Okay. Yep. Yep.
Alright. Close your eyes. Just let me know if you feel this.
Oh, yeah. Yes.
Sorry.
Yes. Stick it in me. Yes.
Perfect. Don't read. Alright. So cranial nerve 5 is intact. Now we're going to move on to palpating the lymph nodes. Postauricular, preauricular, submandibular, submental, posterior cervical, anterior cervical, and supraclavicular. There's no lumps, bumps, or swelling noted of any of the lymph nodes. Now what we're going to do is we're going to test her thyroid. I'm going to put my hands on her throat. What I'd like for you to do is I want you to swallow for me. Okay. All right. So I cannot palpate the thyroid gland at all. Now what I want you to do is I'm going to whisper something in your ear and I'd like for you to repeat it back to me.
Tuesday. Tuesday.
Good, good. All right, so everything as far as her ears and eyes is intact. Just thinking back, trying to make sure that I haven't missed anything. Okay. Now what I'm going to do is I'm just going to do an over general survey of the chest. I'm going to palpate the chest and the back, noting that the spine is midline. Any tenderness, pain?
Right there.
Is that normal?
Yeah, I got sciatic nerve.
Sciatic nerve?
Yeah.
Okay. Alright. Well, what I'm going to do now is I'm going to listen. I'm going to check for what we call tactile fremitus. I want you to say 99.
99.
Again.
99.
Again.
99. 99. 99. And 99.
Okay. Everything is resident with tactile fremitus. Now what I'm going to do is I'm going to listen to the carotid arteries of the neck with the diaphragm and the bell of my stethoscope. No bruise or thrills are noted this time. Alright, I'm going to let you lay back. What I'm doing is I'm looking for jugular vein distension. I'm looking at, there you go. Alright, so what I'm looking at is making sure that there's no jugular vein distension bilaterally. And there's no jugular vein distension. I'll have you sit up. Alright. I'm going to have you smile for me. Alright, I want you to stick your tongue out and puff your cheeks up. Alright. Now, if you can relax, I want you to clench your teeth together. Alright. Any pain? Okay. Temporomandibular joint is intact. Now what we're going to do is we're going to listen to percuss the anterior chest and the posterior, the back. Then we're going to listen for breath sounds and listen to heart sounds. And percussion of the back is resonant. There's resonance over all of the lung fields. All right, we're gonna listen to breath sounds posteriorly, and then we'll do them anteriorly. Deep breath for me. Alright. Breath sounds are clear and equal bilaterally. And we're going to listen to the heart sounds with the diaphragm and the bell of the stethoscope. Listen for any breeze, thrills, any abnormal heart sounds. The aortic. Pulmonic. Tricuspid and mitral. S1 or S2 are intact, no adventitious heart sounds, no bruise, no thrills, no abnormal heart sounds. We're going to check the range of motion in your neck while we're there, just to get it out of the way. So what I want you to do is look down, and back up, side to side, and rotate your head. All right. So range of motion for the neck is good, flexion, extension, rotation. Now what we're going to do is we're going to go ahead and we're going to have the patient lie down. We're going to inspect the abdomen. We're going to auscultate the abdomen and then palpate the abdomen. So I'll have you like that. We're also going to listen to heart sounds as well with the patient lying back. So we're going to visualize the abdomen. We're looking at the abdomen. We're looking for any scars, trauma, any bulges. Anything that might be out of the ordinary, which is normal, it's non-distended. So we're going to listen to the bowel sounds in all 4 quadrants. We're going to listen for the aortic. Bowel sounds are intact in all 4 quadrants and active. There are no bruise, thrills, or he's heard with the aortic. Now we're going to palpate the abdomen. What we're going to do is first we'll start with light palpation and then go to deep palpation. Let me know if any of this hurts you, okay? Now deep palpation, see if we can feel the liver. the spleen. I'm unable to palpate the liver and the spleen. Now I'm going to percuss just to find the size of the liver. About 3 centimeters for the liver. Also going to check the inguinal lymph nodes and the femoral pulses. Alright, so femoral pulses are intact bilaterally. I don't feel any abnormalities in the inguinal area. No swelling of any lymph nodes. So what we're going to do now is I'm going to have, I'm going to go ahead and inspect the front of the legs while I'm here. Nothing out of the ordinary. Skin is all intact. Skin is warm and dry all over the body. Well hydrated. I'm going to check the carotid.
I didn't know you was sweating.
The brachial pulses. Radial. Go ahead and check you were just rest your leg. I'm checking pulses for the popliteal. The posterior tib. And the dorsalis pedis. All the pulses are intact. They're at a +2. While I'm here, I'm also going to check capillary refill. It's less than 2 seconds. Also in the feet, less than 2 seconds. Again, all pulses are +2 and equal bilaterally from extremities. Now what I'm going to do is I'm going to have you sit back up. Alright, now I want you to close your eyes. And when you close your eyes, I'm going to place an object in your hand and I want you to tell me what that object is.
A key.
Alright, so stereogenesis is intact. Alright, so okay, we're good. We're going to defer the genital exam, all that. Gussie's well aware that she should be doing self-breast exams monthly, and she has her mammogram once a year. So now what we're going to do is I want to assess the strength in your arms. So put your hands here. Now, don't let me pull you. Don't let me push you. All right. Inspecting the hands and fingers, there is noted, looks like some arthritis in both hands and her fingers, bilaterally, in each distal phalanx joint. I want you to squeeze my hands. Grip is good. Now what I would like for you to do is I'd like for you to shrug your shoulders. All right. Can you put both hands above your head? out to the side, to the front, to the back. And can you, all right, so range of motion with the shoulders is good. External rotation, flexion, extension, same thing with your elbows. And your hands and fingers, except for where you have the arthritis, I know that's tough. All right, wrist down and up, and can you do them side to side? All right, so range of motion in all the arms is intact. All right, I'm gonna have you stand up, and we're gonna just do a general inspection. What I'd like for you to do is just give me a couple of steps this way and back. All right, you can have a seat right back there. So gait is normal, no limps, nothing noted abnormal with the gait. What I'd like to do now is I'm going to palpate your arms and your legs. Mm-hmm. All right. And what I want to do is I'm going to let you lay back. We're going to test the range of motion in your knees and legs. What I'd like for you to do is we're going to test the hips. You know, no problems with your hips. Okay. Can you lift your legs up one at a time? Okay. And can you take your leg out to the side? Okay. Out to the side there. And flex. All right. And don't let me push your feet. And don't let me pull. All right. So range of motion is intact with the hips, knees, ankles, and feet. Strength is very good. I'm gonna go back and also test the abdominal reflex. Which is good and intact. Gonna test her reflexes. So I'll let you see. It's not wanting to go back in. That's okay. I see. Alright, we'll fix it. Alright. So I just want you to rest your arm right there. All right, upper extremity reflexes are intact. That's the triceps, biceps, and brachioradialis are intact. All right, let me see if I can get this fixed. So I'll set that there. Do that. All right, perfect. Now we're going to check her patellar. Her Achilles. And we're going to also test her Babinski's reflex. I'm just going to borrow your shoe a second. Just relax your foot. And good. Get your shoes back on. I like those shoes, they look comfortable. Alright, deep tendon reflexes are intact. Alright, so what I would like for you to do is I'd like for you to take your hands, and then I would like for you to take one foot and cross it over and lay it down the front of your leg. Okay. Alternating movements is intact. And I'm gonna have you stand up. All right, now what I'd like for you to do is put your feet together and your hands at your sides. Stand there and notice and no swaying at all. Balance is good. Now I'd like for you to close your eyes. She's not swaying, so her balance is intact. All right, you can open your eyes now. So balance test is good. Range of motion, flexion, extension, and all the lower extremities is intact. All of her pulses are +2. So at this time, I can't think of anything that I need to do as far as the assessment goes. I thank Gussie for coming in and participating in my project for Auburn University, and I hope you have a great day. Thank you.